At least every 2 seconds, a child is born with sickle cell disease. And sickle cell disease is not just about pain, but also a fight for life, hope, and dignity. Many people, or millions of people, are living with the disease, but some of them are suffering in silence. But together, we can break the silence. So your doctor's television with the clinician in Masereka, and now I'm going to take you through sickle cell disease briefly. But before we dive into that, hit the subscription button, click the notification bell so that you do not miss any of our videos whenever we upload. So sickle cell disease is a chronic and a hereditary disease that affects the hemoglobin, a molecule in your red blood cell that transports or carry oxygen throughout our body. So when you have an abnormal hemoglobin, it makes it hard, it makes the red blood cells be hard and have a sickle shape. So that means these people always move or live with chronic anemia. They always have a low hemoglobin count. So it being hereditary, sickle cell moves from parents to the children. You cannot have sickle cell disease unless your parents have or carry genes for this disease. So sickle cell may present at the age of 3 months to 6, but in some cases it can present in or at a later age. So it may present with a lot of pain, it may present with swelling of the hands or the feet, it may present with low blood HB or anemia, it may present with pneumonias or recurrent infections. But also, it may present in its worst forms. For example, it may present as acute chest syndrome, where a patient or a child has severe chest pain, cough, fever, difficulty in breathing, and also low oxygen levels in their blood. So also, it can present as a painful crisis due to blockage of the blood flow. So this may be common or is common in the joints, though it can be elsewhere in the body. It can also present as acute aplastic crisis, where your body is not able to produce enough red blood cells. It can also present as stroke, where a child or the patient will present with difficult or inability of using their hand or leg. They may present with convulsions, they may present with altered level of consciousness. So it may also present with acute hemolytic crisis, where the red cells are being broken down very fast at high speed. So patient will be very, very anemic. So it may present in very many other forms. For example, the visual impairment and others. So a person or a patient who is living with sickle cell disease, you should not lose hope, but remember about this crisis. Remember and know that you can have a crisis at any time, and so you have to be ready to respond to this crisis. Always remember to keep your body hydrated. Always remember to go to the facility or to go meet your doctor for regular checkups and follow-ups. Always remember to take your folic acid. If you're using hydroxyurea, please don't skip any dose. Adhere to that treatment because it helps you in building your hemoglobin. If you're living with sickle cell disease, remember to always keep your body hydrated, because when your body is hydrated, your blood will be thin and it will be easy for it to penetrate or maneuver through your blood vessels. And to the world, support these patients who are living with sickle cell disease. You can support them financially because they are always on drugs, they are always having a lot of issues, they are always living in depression. So remember to support them psychologically, socially. Remember to support them financially or any other kind of support. So to the world, these people also are people. These people are human beings like any other, just that it is unfortunate for them to live with the disease that is always causing them a lot of complications and issues. So to the partners who are planning to join or marry, remember to always have your genotype checked. You need to ensure that you're not carriers, or if you're carriers, the male partner and the female partner are all carriers, that means you carry 50% of producing people or children who are having this disease. So it is important for a carrier, if you're a carrier, you marry a person who is having a normal hemoglobin, who is not having a gene for this disease. But if you're carriers, then you're definitely going to produce people or children who are having the sickle cell disease. Though you have 25 chances of producing a normal child or a child with a normal hemoglobin, but you carry at least 50% of producing a child or children with this disease. So together we can change the narrative. And thanks for watching. You're still at Doctor's Television with the clinician Kasireka. Remember to always like, share, comment, and stay blessed. Bye bye.